Have you ever wondered how legends are born? In the 19th century, the world was obsessed with wonders. Circus posters by P.T. Barnum screamed, "The Monkey Woman," "The Ape Lady," a marvel of nature. Crowds paid their last cents to see them, women with thick, flowing beards. To the public of that time, they were freaks, errors of nature, or the result of a curse. But to modern medicine, these women aren't a mystery. They are patients with a clear diagnosis. Today, we know that behind every such beard stood a complex biological drama we call PCOS, Polycystic Ovary Syndrome. In this video, we're going on a medical detective hunt. We'll explore the lives of the most famous bearded women, why Victorian doctors called it the diabetes of bearded ladies, and how a condition that once made women objects of ridicule now affects 1 in 10 women worldwide. Let's start with Annie Jones. Born in Virginia in 1865, by the age of 9 months, her chin was already covered in a noticeable fuzz. Her parents, terrified but also eager to profit, rented her out to the showman P.T. Barnum. Annie became the most famous bearded lady in the world. She was educated, a talented musician, and spent her life fighting to be seen as a human being, not an animal. Her beard reached 30 centimeters in length. Then look at Clémentine Delait. Her story is completely different. She wasn't a circus slave. She was a cafe owner in France. She shaved every day until a bet changed everything. She wagered that she could grow a full beard, and she won. Clémentine became so popular that she renamed her establishment the Café of the Bearded Woman. She was happily married and lived a full life, turning her condition into a successful brand. But then there was the tragic Julia Pastrana. She was labeled the ugliest woman in the world. Besides her facial hair, she had thickened skin and distorted features. Her husband-manager exploited her even after death, mummifying her body for exhibition. What connected these women? Hypertrichosis? Perhaps. But most of the symptoms, especially in Annie and Clémentine, point to endocrine chaos. Let's put away the circus posters and open a medical textbook. Why does a woman grow a beard? Every woman has male hormones, androgens like testosterone, in her body. This is normal. They are responsible for libido, bone strength, and mood. But in PCOS, the system breaks down. In 1921, 2 scientists, Auchard and Thiers, described this condition with a very accurate name, diabetes of the bearded women. They noticed a strange link. Women with facial hair often had issues with blood sugar. How does it work? It starts with insulin. When the body stops responding correctly to insulin, a condition called insulin resistance, the pancreas starts pumping it out in massive amounts. This excess insulin acts as a powerful stimulant on the ovaries. It literally forces the ovaries to produce too much testosterone. The result? Hirsutism. This is the medical term for the growth of coarse, dark hair in women in areas where it typically isn't found: the chin, chest, and abdomen. In the circus stars of the past, these hormone levels were likely astronomical. We tend to think bearded ladies are a thing of the past, but that's a mistake. PCOS hasn't disappeared. In fact, due to modern lifestyles, sugar consumption, and stress, the number of cases is rising. Today, we've just learned to hide it better: laser hair removal, makeup, and hormonal therapy. But PCOS is about more than just hair. It's a systemic failure. Acne, painful breakouts along the jawline that don't respond to regular creams. Alopecia, while hair grows on the face, it thins on the scalp. Metabolism, weight gain that seems to happen out of thin air and is nearly impossible to lose because of that same insulin issue. Fertility. The ovaries become filled with small follicles, or cysts, that prevent ovulation. It is one of the leading causes of infertility. The most tragic part is that many women live with these symptoms for years, blaming themselves for being lazy or neglecting their skin, unaware of the hormonal storm inside them. The story of the circus-bearded ladies isn't just a tale of strange people. It's a story of how medicine turns fear into understanding. What was once seen as a curse is now a medical condition that can and should be managed. Annie Jones had no choice. She was forced to be an exhibit. Clémentine Delait had the courage to make her flaw her pride. Today, we have the knowledge. If you recognize yourself in some of these symptoms, remember, it's not your fault. It's biochemistry. And the first step to winning isn't hair removal, it's visiting a good endocrinologist. We've come a long way from the circus ring to modern labs, and the most important lesson we've learned is this: our body is a complex system, and it deserves help, not judgment. Thank you for watching. Did you know about the link between the circus and endocrinology? Let me know in the comments which story surprised you the most. Subscribe for more investigations into the mysteries of the human body. Take care of yourself and your hormonal balance.